Imagine being born with a condition that slowly takes away your ability to move, breathe, and even swallow. For thousands of families around the world, this is not imagination. It is reality. Spinal muscular atrophy, commonly known as SMA, is a rare but serious genetic disease that affects muscle strength and can be life-threatening if not detected early. Thanks to modern medicine, SMA is no longer a hopeless diagnosis, but awareness remains the key to saving lives. Spinal muscular atrophy is a genetic neuromuscular disorder that causes progressive muscle weakness and muscle wasting. The disease primarily targets motor neurons located in the spinal cord. These neurons are responsible for sending signals from the brain to muscles throughout the body. When motor neurons are damaged or lost, muscles stop receiving these signals and begin to weaken and shrink over time. SMA can affect people of all ages, but it most commonly appears in infants and young children. Without treatment, severe forms of SMA can interfere with essential functions such as breathing, swallowing, and movement, making it one of the leading genetic causes of infant mortality worldwide. SMA is caused by a mutation or deletion in a gene called SMN1, which is responsible for producing survival motor neuron protein. This protein is essential for the health and function of motor neurons. When the body does not produce enough SMN protein, motor neurons gradually die, leading to muscle weakness. The disease is inherited in an autosomal recessive pattern, meaning both parents must carry the faulty gene for a child to develop SMA. Most carriers show no symptoms and may not even know they carry the gene. In the United States, approximately 1 in every 40 to 60 people is an SMA carrier, making genetic screening extremely important. SMA is classified into several types based on the age of onset and severity. The most severe form, known as type 0, begins before birth and is associated with decreased fetal movement and profound weakness at birth. Infants with this type often face life-threatening complications within weeks. Type 1, SMA, also called Verdnig-Hoffmann disease, appears within the first 6 months of life. Babies with type 1 have severe muscle weakness, poor head control, and difficulty breathing and swallowing. Without treatment, survival beyond early childhood was once rare. Type 2 SMA usually appears between 6 and 18 months of age. Children with this type can often sit but are unable to walk independently. Muscle weakness progresses over time, but life expectancy is significantly improved with proper care. Type 3 SMA appears later in childhood or adolescence. Individuals may initially walk and live independently, but may gradually lose muscle strength over time. Type 4 SMA begins in adulthood and typically causes mild to moderate muscle weakness with a normal life expectancy. Early signs of SMA often appear subtly, but progress quickly if untreated. In infants, symptoms may include floppy or weak limbs, poor head control, difficulty feeding, shallow breathing, and delayed developmental milestones. Older children and adults may experience frequent falls, muscle fatigue, tremors, and difficulty climbing stairs or standing from a seated position. Recognizing these symptoms early is critical, as early intervention dramatically improves outcomes. In the United States and several other countries, SMA is now included in routine newborn screening programs. This allows doctors to detect the disease before symptoms even begin. Diagnosis is confirmed through genetic testing, which identifies mutations in the SMN1 gene. Additional tests, such as blood tests, electromyography, and family genetic screening, may also be used. Early diagnosis, especially before symptoms appear, can allow children with SMA to develop motor skills that were once thought impossible. Until recently, SMA had no cure. Today, medical breakthroughs have completely transformed the outlook for patients. Gene therapy treatments such as Zolgensma work by replacing the faulty SMN1 gene with a healthy copy, often through a single infusion. This therapy has been approved in the United States and has saved countless lives. Other treatments, including Spinraza and Evrysdi, help the body produce more SMN protein and are used in both children and adults. These therapies do not cure SMA, but they significantly slow disease progression and improve quality of life. Globally, SMA affects approximately 1 in every 10,000 births. In the United States, early screening programs and access to advanced treatments have greatly improved survival rates. However, in many parts of the world, delayed diagnosis and limited access to treatment remain major challenges. Global advocacy efforts, patient awareness campaigns, and social media storytelling are helping bring attention to SMA and push for equal access to life-saving therapies. With early diagnosis and treatment, many people with SMA are now living full, meaningful lives. Children attend school, adults pursue careers, and families learn to adapt and thrive. While SMA presents daily challenges, it does not define a person's intelligence, dreams, or potential. While SMA cannot be completely prevented, genetic carrier screening before pregnancy can help families understand their risk. Prenatal testing and genetic counseling offer valuable information for family planning. Most importantly, newborn screening ensures early treatment and better long-term outcomes. Awareness leads to early diagnosis, early treatment, and saved lives. It helps reduce stigma, improves access to care, and supports ongoing research. In the United States, August is recognized as SMA Awareness Month, highlighting the importance of education and advocacy. Spinal muscular atrophy is no longer a silent disease. With awareness, science, and compassion, lives can be changed forever. Share this video, educate others, and support SMA research, because early action can mean the difference between loss and hope.